This presentation is designed for those that are approaching Medicare age, typically age 65. We will highlight the main areas of Medicare that you should be aware of. However, we will not go into the detail, and you should follow up with someone to address your specific questions as you prepare to sign up for Medicare. Medicare is known for having 4 parts, and that's true. However, it's really 3 benefit parts and 2 different ways or 2 different paths to get the 3 benefits. Medicare Part A provides benefits for inpatient care, skilled nursing care, home health, and hospice. There are specific rules for each of these benefits, and there's also a specific time to sign up, an initial enrollment period. Usually, Medicare Part A will be premium free. However, there are other out-of-pocket costs like deductibles and copays. So when do you sign up? You have a 7-month initial enrollment period, and it starts 3 months before the month of your 65th birthday, and then goes 3 months after your birthday month. You apply through the Social Security Administration. If you happen to be drawing your Social Security benefit prior to getting Medicare, you will automatically be signed up for Medicare Part A and also for Medicare Part B. Medicare Part B provides benefits for outpatient care, physician clinic services, ambulance, durable medical equipment for things like crutches or walkers, and observation care. You'll want to talk with someone specifically about how observation care and inpatient care are very different when it comes to qualifying you for skilled nursing care. There is a premium for Part B, and you will continue to pay that regardless of any other choices you make with Medicare. For Part B, Medicare generally pays 80% of the approved services, and you will pay 20%. While it is possible to delay signing up for Medicare Part B if you have employer coverage, you want to review the specific requirements about your employer to determine if you qualify to delay the coverage. If you don't qualify to delay coverage, you will be penalized later once you begin to sign up for Part B. That penalty will continue as long as you have Part B. With Medicare Part A and Part B, which is sometimes called Original Medicare, there are more choices that you have. Medicare Part D is for prescription drug coverage, and you could choose a plan to help pay for your prescriptions. There are usually several choices. You will have an opportunity to switch plans each year if you like a different plan better. Just like we said earlier with Part B, you can also delay the Part D drug coverage. However, there are penalties again if you don't qualify to delay the coverage. You'll want to speak with someone about the specific situation. Depending on your income level, you could pay extra each month for both Part B and Part D. And again, please review this with someone so that you understand what your premiums will be for these coverages. There's another choice that you can make, and that's to purchase a Medicare Supplement plan. We know that Medicare doesn't cover everything. We know there were deductibles and copays with Part A. We know that Part B has an 80/20 coverage. And so these Medicare Supplement plans, also sometimes called Medigap Plans, are designed to cover the gaps in the coverage, those out-of-pocket costs that you have. There will be a premium. We know that for most people, Medicare Part A will be premium free. We know that for most people, the Medicare Part B premium, or at least the lower cost of Part B, is $144.60 per month if you signed up in 2020. It can be higher if your income is higher. The premium for Part D in Minnesota ranges from about $20 a month up to $95 a month, with the averages around $32. Those premiums can also be higher, again, if your income is higher. There is a wide variation in cost for a Medicare Supplement plan. Depending on where you are in the country, these prices can vary quite widely. There's one source that puts the average across the country at $180 per month. Now let's look at something called Medicare Part C or Medicare Advantage. This is the second way or the second path to get your different Medicare benefits. Medicare Part C takes the place of Parts A and B, although you will continue, as we stated, to pay the Medicare Part B premium. So why would anyone want to sign up for a Medicare Advantage plan when they could sign up for Original Medicare and include a Medicare Supplement plan that would pay for nearly all of their out-of-pocket costs? One of the reasons is that because of the way these plans are structured, the government allows them to offer some extra benefits that would ordinarily not be part of your original Medicare choice. You can have basic dental, hearing, vision, and sometimes gym memberships are part of the benefits that a Medicare Advantage plan offers. The way that the money is structured allows the Medicare Part C Advantage plans to charge premiums that can be as low as $0 per month or several dollars per month, but generally much less than a Medicare Supplement plan that we talked about earlier on the original Medicare path. Most of these Medicare Part C plans include a prescription drug coverage, and so you will not need to purchase a separate Part D plan. If for some reason they don't include drug coverage, you can simply add a Medicare Part D drug plan, as we discussed earlier. The choice to go with a Medicare Advantage plan or to go with Original Medicare is something that could have impact on you for years, so you'll want to talk with someone about your specific situation. It's a big decision, and you need to be able to weigh all of your different options, so you'll want to take your time and you'll want to start early in discussing this option. One of our community-based organizations, the Senior Linkage Line, has paid staff and volunteer staff that can sit down with you on a one-on-one basis and review the details of your Medicare choices. Be prepared so that you can make a smooth transition to Medicare, knowing all of the different choices that you have. You can call them at 800-333-2433. They also have material that they can send you that can help you understand all of the different benefit choices that Medicare offers. Here are some additional websites that you may find helpful. Medicare.gov will go into much detail in explaining Medicare. The SeniorLinkageLine.com is a website that you can go to see the services that the Senior Linkage Line provides. And then the IRS, if you have tax questions at the federal level, and then the state of Minnesota with their website for tax questions here in Minnesota. I wish you the best as you begin your journey in deciding which benefit choices you will make with Medicare. Good luck.